Causes. Your headache symptoms can help your doctor determine its cause and the appropriate treatment. Most headaches aren't the result of a serious illness, but some may result from a life-threatening condition requiring emergency care. Headaches are generally classified by cause. Primary headaches. A primary headache is caused by overactivity of or problems with pain-sensitive structures in your head. A primary headache isn't a symptom of an underlying disease. Chemical activity in your brain, the nerves or blood vessels surrounding your skull, or the muscles of your head and neck, or some combination of these factors can play a role in primary headaches. Some people may also carry genes that make them more likely to develop such headaches. The most common primary headaches are cluster headache, migraine with and without aura, tension headache, also known as tension-type headache, trigeminal autonomic cephalalgia (TAC), such as cluster headache and paroxysmal hemicrania. A few headache patterns also are generally considered types of primary headache, but are less common. These headaches have distinct features, such as an unusual duration or pain associated with a certain activity. Although generally considered primary, each could be a symptom of an underlying disease. They include chronic daily headaches, for example, chronic migraine, chronic tension-type headache, or hemicranias continua, chronic daily headaches, cough headaches, exercise headaches, sex headaches. Some primary headaches can be triggered by lifestyle factors, including alcohol, particularly red wine, certain foods, such as processed meats that contain nitrates, changes in sleep or lack of sleep, poor posture, skipped meals, stress. Secondary headaches. A secondary headache is a symptom of a disease that can activate the pain-sensitive nerves of the head. Any number of conditions, varying greatly in severity, may cause secondary headaches. Possible causes of secondary headaches include acute sinusitis, arterial tears, carotid or vertebral dissections, blood clot, venous thrombosis within the brain, separate from stroke, brain aneurysm, a bulge in an artery in your brain, brain AVM, brain arteriovenous malformation, an abnormal formation of brain blood vessels, brain tumor, carbon monoxide poisoning, Chiari malformation, structural problem at the base of your skull, concussion, dehydration, dental problems, dehydration, encephalitis, brain inflammation, giant cell arteritis, inflammation of the lining of the arteries, glaucoma, acute angle closure glaucoma, hangovers, high blood pressure, influenza, flu, and other febrile fever, illnesses, intracranial hematoma, blood vessel ruptures with bleeding in or around the brain, medications to treat other disorders, meningitis, inflammation of the membranes and fluid surrounding your brain and spinal cord, monosodium glutamate, MSG, overuse of pain medication, panic attacks and panic disorder, post-concussion syndrome, pressure from tight headgear, such as a helmet or goggles, pseudotumor cerebri, increased pressure inside the skull, also known as idiopathic intracranial hypertension, stroke, toxoplasmosis, trigeminal neuralgia, as well as other neuralgias, all involving irritation of certain nerves connecting the face and brain. Some types of secondary headaches include external compression headaches, a result of pressure causing headgear, ice cream headaches, commonly called brain freeze, rebound headaches, caused by overuse of pain medication, sinus headaches, caused by inflammation and congestion in sinus cavities, spinal headaches, caused by low pressure or volume of cerebrospinal fluid, possibly the result of spontaneous cerebrospinal fluid leak, spinal tap or spinal anesthesia, thunderclap headaches, a group of disorders that involves sudden, severe headaches with multiple causes. Headache equals a feeling above your shoulders that you don't like. I find people can get very clever about the word headache. It's not a headache, doctor, but a pain in my head. It's not headache, but pain in my neck, face, mouth, nose, ears. I try to be pleasant about this. Only 1 in 20 people never suffer headache. Headache is perceived when neural pain pathways are activated in relation to the head. There are more couples than pain pathways elsewhere in the body, and vulnerable to feedback loops. It is helpful to think of pain as an alarm or warning system, like a fire alarm or the warning lights in your car. If you knew no better, you'd think all fire alarms meant flames and all oil lights meant an empty sump. Experience teaches otherwise. In fact, when a person with new headache consults a primary care practitioner, the risk of a serious cause is about 1 in 1,000. The predominant reason why head pain pathways fire off in the absence of serious disease, most likely reflects alteration in the capacitance of ion channels in the sensory nerve membrane. Headache is not normally caused by stress, diet, sinus disease, posture, neck discs, blood vessels, etc., etc. If you take a brain scan (MRI or CT) in headache patients, the chance of finding an abnormality is the same as in people without headache. Headache is not infrequently a disabling matter but has good evidence-based treatment strategies, among which the most important is that the frequent greater than 9 days per month use of rescue medications, painkillers, triptans paradoxically worsens headache. Headache often improves naturally, leading to mistaken belief in the efficacy of treatment. Examples of this in some of the answers here: beware confirmation bias, and the Dunning-Kruger effect. What do I know? I am a UK neurologist specializing in headache for over a quarter century, during which time I have seen more than 10,000 headache patients.